Does Medicare Part B have copayments and coinsurance? Have you ever wondered how much you will actually pay for services under Medicare Part B? It is a common question, especially when managing healthcare costs. Let's break it down clearly. Medicare Part B does not have fixed copayments for most services. Instead, it requires both a deductible and coinsurance. This means you will need to pay a certain amount out of pocket before Medicare starts to help with your medical expenses. Every year, you must meet an annual deductible before Medicare begins to pay. For the year 2025, this deductible is $257. Once you have paid this deductible, Medicare generally covers 80% of the Medicare-approved amount for covered services. You are responsible for the remaining 20%, which is known as coinsurance. So, for most doctor visits and outpatient care, you will pay 20% of the cost after meeting your deductible. This is where understanding coinsurance becomes important. It is a percentage-based cost-sharing model, unlike copayments, which are fixed dollar amounts paid at the time of service. While most services under Medicare Part B do not have copayments, there are exceptions. For instance, some clinical laboratory tests may not cost you anything at all. If your healthcare provider accepts assignment, they agree to accept the Medicare-approved amount as full payment. In this case, you only pay the 20% coinsurance. However, if your provider does not accept assignment, you might have to pay the 20% coinsurance plus an additional amount up to 15% above the Medicare-approved amount. This is the legal limit for balance billing. It is also important to note that Medicare Part B does not have an out-of-pocket maximum. This means that your coinsurance costs can add up over time, depending on how often you need services. To recap, you will pay an annual deductible of $257 in 2025 before Medicare Part B starts paying. After that, you will pay 20% coinsurance on most covered services. Fixed copayments are generally not charged under Part B, except in limited cases. If your provider accepts assignment, your out-of-pocket coinsurance is limited to 20% of the Medicare-approved amount. If they do not accept assignment, you may pay up to 15% more than the approved amount in addition to your coinsurance. Remember, there is no out-of-pocket maximum for Part B, so keep track of your expenses to manage your healthcare budget effectively.